Hello, everyone. Thank you for joining me today. My name is Tanya Vinson. I'm a recovering addict. My sobriety date is 9/27/22, and I'm here today to talk to you about the connection between depression, anxiety, and addiction. These three conditions don't just exist separately, they overlap, creating cycles that are extremely hard to break. In fact, many people who struggle with substance use disorder also live with depression and anxiety. This overlap, usually called dual diagnosis, makes treatment more complicated and recovery much more challenging. Today, I'll explain why this issue matters, how these conditions interact, why integrated treatment is necessary, and what models of care are most effective. By the end, I hope you will see not only the seriousness of the problem, but also the hope that lies in better approaches to care. Depression and anxiety are two of the most common mental health challenges worldwide. Addiction is also very prevalent. And when substance use occurs with one or both of these, the result is devastating in many ways. Families often find themselves stuck in a cycle of crisis. Communities carry higher health costs, increased crime, and strained resources. On a personal level, an untreated dual diagnosed individual has a reduced chance of maintaining employment, obtaining education, and sustaining healthy relationships. For example, imagine someone dealing with depression who turns to alcohol to ease the emotional pain. At first, drinking may numb the sadness, but over time, the drinking worsens their depression, adds anxiety, and can and most likely will lead to dependence. Now, that person is not only fighting a mental disorder, but also an addiction that reinforces the very symptoms that they were trying to escape. This cycle highlights the importance of understanding how these issues connect and why addressing them together is crucial. So, how do these conditions interact? Let me give you a couple of definitions first. Depression often involves hopelessness, fatigue, loss of interest, and difficulty functioning. Anxiety brings constant worry, relentlessness, and physical symptoms like racing thoughts or poor sleep. When combined, these conditions create unbearable stress. Many people turn to substances as a way to cope, a pattern known as self-medication. While drugs or alcohol may provide a temporary sense of relief, the effect is short-lived and ultimately harmful. Substances change brain chemistry, making depressive episodes worse, heightened anxiety, and fueling dependence. This creates a vicious cycle. Depression and anxiety drives a person to seek short-term relief through substances. Substance use worsens depression and anxiety symptoms. Together, they increase relapse risk, suicidal thinking, and hospitalizations. This cycle isn't just theory. It shows up in treatment centers every day. As a matter of fact, I work in a treatment center, drug and alcohol treatment center. We come across these people frequently. They come in, they leave, they think they're better. They have so much hope to do better in the world. They go out and they fail. And they come back not understanding why, what happened. Why wasn't I successful? Why can't I get this? It's not their fault. They just need more care than what our facility can give them. When we realize this situation, we try to take them, send them to a dual diagnosis center to get them more help. But for decades, mental health and addiction were treated separately. Someone with an addiction went to one program while someone with a mental health issue went to another. Or if someone suffered from both, the thinking was, well, we'll just deal with this issue first and then we'll deal with this one. But research and clinical experience show this approach does not work. If depression or anxiety remain untreated, relapse is almost inevitable. And if the addiction is left unaddressed, therapy for mental health rarely succeeds. This is why integrated treatment is essential. Integrated care means treating both conditions at the same time in the same place with providers who coordinate care. Some examples include cognitive behavioral therapy, which helps individuals recognize and challenge harmful thought patterns while also addressing substance triggers. Medication-assisted treatment, where addiction medications are combined with antidepressants or anti-anxiety medications. Trauma-informed care, which recognizes that many people with dual diagnoses carry past trauma that must be addressed for healing to happen. And also, we have peer support combined with professional care, where lived experience provides inspiration, insight, and accountability alongside clinical expertise. Integrated programs succeed because they treat the whole person instead of dividing problems into separate boxes. Patients feel more supported, recovery lasts longer, and relapse rates decrease. The more comfortable a patient is, the more they trust their surroundings and the people in it. Comfort and trust are huge when it comes to releasing past traumas. Beyond integration, effective programs take a whole person approach. This means going beyond medical care and addressing the broader challenges that affect recovery. Whole person care examines housing, employment, family relationships, and community support. If someone leaves treatment only to face homelessness, joblessness, and social isolation, their chances of staying sober are slim. Community-based models step in here. These include recovery housing, peer-led support groups, vocational training, and recovery-friendly community programs. They emphasize that recovery is not just about stopping substance abuse. It's about building a meaningful life worth protecting. Isn't that what we're all after? For example, recovery-oriented systems of care focus on long-term support networks. This might mean pairing someone with a peer recovery life coach, connecting them to community resources, or creating supportive environments in schools and workplaces. When people are supported in all areas of life, recovery is much more sustainable. To wrap up, let's return to the central idea. Depression, anxiety, and addiction are not separate battles. They are deeply interconnected conditions that feed into one another. Self-medication may feel like relief in the moment, but in reality, it fuels the cycle of suffering. Treating these conditions separately does not work, but integrated treatment does. And when we include a whole person approach and community supports, we give people the best possible chance to thrive and succeed. So why does this topic matter? Because it reminds us that recovery is not just about one person fighting battles alone. It's about how we, as families, communities, and healthcare systems, create the conditions for real healing. Thank you so much for your time today. I hope that you got a lot out of this.